For 7 years now, Dr. Christopher Miller has been helping patients across West Michigan fight and relieve back and neck pain.
And he's our expert on woodtv.com, and he's here today along with two of his patients to talk about helping people relieve that chronic neck and back pain. Welcome.
Yeah, so first we're going to talk to Dr. Miller. We have Shirley and David here as well. But Dr. Miller, you know, a lot of people see this. A lot of people know exactly what we're talking about here. What kind of patients do you help on a regular basis?
Well, that's why I wanted to come back today. I've been here numerous times talking about different seminars and things that I do, but I really want to come back and reach your viewers out there that just have chronic back or neck pain, the ones that are the worst of the worst. Maybe they've tried a bunch of different treatments, they're discouraged by the results they're getting, and maybe they've lost hope or they think there's nothing left out there for them. We have a new approach. We have a medical device called the DRX 9000, and it's a way to help heal and repair these injured discs and the symptoms associated with that. So it's really a unique process, and we're the only one in West Michigan to offer this for the neck and lower back.
So that technology is really getting a lot better. And so I guess explain to me the DRX 9000 a little bit, why it's different and what the technology is really.
Well, first of all, it's non-invasive, non-surgical, so you don't have to worry about the risks associated with that. And it just really works on not just covering up symptoms, but correcting the cause of these symptoms. It is a bit of a stretch, a gentle stretch to relieve pressure on the discs, and it's a cumulative effect, so each visit builds on the one before. But you know, the goal is to get people out of pain, get you guys functioning again so that you can do the activities that you want to do, and teach you what you can do to maintain that health on your own, so you don't have to keep doing this over and over again.
Yeah. Well, it's impressive that you've seen the worst of the worst cases, and I think it's really a testament to your work that you have a couple of your patients here that have experienced the treatment that you do. Let's talk with Shirley first. Now, Shirley, you'd been coping with pain for more than 20 years.
Yes.
Tell us what you had experienced and what your life was like.
I would experience when I try to get out of bed in the morning, when I got up, I get up like this slowly, but to walk, I'd have to hold, like this to walk down the hall, trying to relieve the pain from that sciatic, and just to help it a little bit. And I went to chiropractors, and they would adjust me and give me some relief, but then I'm right back again, sometimes 3 times a week. And so I read Dr. Miller's in the newspaper, his ad, and then I saw it on TV, and I said to my husband, can I give this a try?
Sure. Yeah.
Anything will help. And he said, of course. So I did have a consultation with Dr. Miller. And the nice thing about it, he didn't right away tell me what was wrong with me. He said, first of all, we have to have an MRI. Now, this was the first doctor that ever said that to me, an MRI. And then he showed that what was wrong, and we took it from there. And I went to the, for 5 weeks, I went 4 times a week, and I'm fine. I can get up, walk, get out of a chair, walk, no pain at all.
That is wonderful.
I'm not kidding you when I say I suffered for years with back pain.
And you said
thanks to Dr. Miller.
You said it's actually been about a year since you had this treatment.
Yeah,
and
I think it was last June or July I started.
And you're still feeling great.
Yeah. Oh, yeah.
Still moving.
Yeah. I'm going to play golf this year.
Great. All right. That is so good to
play it
hear.
last year.
Well, David, tell us a little bit about what you had been experiencing and, when you went to see Dr. Miller.
Well, I've had Crohn's disease probably all my life, looking back on it, and been medicated with prednisone. And over the course of those years, I've developed stenosis of the spine, which degenerates your disc. For probably the last 10 years, I've had terrible back pain. You started your day out with a pain pill and pretty much ended your day with a pain pill, and that's not much of a day left. And I've tried everything, had the pain shots, the therapy, and talked about surgery. Nobody could give me a definite prognosis of what would happen. So I was in pain for a long time, and I happened to see Dr. Miller's ad in the Advance, and I read it, and I thought, well, laid it on the table, and it sat there regrettably 2 weeks. Should have been sooner. And decided I had nothing to lose, and I didn't. And I got in the program, and it was an excellent program. It's 5 weeks on the 6000 machine and 5 weeks on the Spine Force machine, which in 4 days of the first 6,000 machine,
Right.
I was off pain pills
Wow.
in 4 days, which was shocking to me, but it's true.
And it's almost unbelievable to hear
Yeah.
this and the changes. And we talk about years, 20 plus, and you said for a long, long time you'd have been experiencing pain. How is your approach, Dr. Miller, so different? Is it because the technology that you're using?
Well, that's the big part of it. Excuse me. Like I said earlier, we're just trying to really correct the cause of the problem, not just cover up the symptoms, and that's what makes the big difference.
That is amazing. Well, congratulations
Yes,
to you both.
great
This is
stories.
wonderful
I'm
to
sitting here
hear.
just, oh my gosh, just so happy for both of you, and thinking of my dad suffers from the same thing, a lot of neck and back pain. So it's so great to see both of you just completely life-changing.
It is life-changing.
Certainly. Well, don't waste any time. I guess that's the
right.
moral of the story here. And you are offering a special to 8 West viewers for the first 10 people who call, and those among them who qualify. You are offering $100 off each DRX 9000 treatment, which is quite an offer there, Dr. Miller. And so people should get on the phone because
Well, there's no reason not to call. Take action. See what you can do to help them out.
Absolutely. Okay, so the first 10 people, and you must qualify. Dr. Miller wants to be able to help your symptoms, qualify, and call the office. Thank you so much for coming in today.
So much.
It's really wonderful to hear your stories and to see how you're helping more and more lives.
Thank you.
Thank you, Dr. Miller.
We'll be right back.